Now, in a hospital setting, fall is a very common occurrence, as you already know. And I'm going ahead and giving you some insights on how to monitor, identify, and prevent falls and the role of nurses in fall management. Now, what is the fall? Fall is when a patient descends to the ground, either intentionally or unintentionally. What happens when there's a recurrent fall? The patient sustains injuries, it delays the hospital stay, and increases morbidity and mortality. Talking about the vulnerable population for falls, it is mostly the elderly and the children compared to the other age groups. Now, how to deal with falls? A very good concept to use while dealing with a fall is the stop concept. Stop to deal with the fall. Think what caused the fall in the first place. Observe the patient and their predisposing conditions, and then prevent such falls occurring in the future. Now, there are different types of falls that can happen in a healthcare setting. One is the accidental fall, where the patient steps on or trips on liquid or any spills on the floor. The second is the anticipated physiological fall, which are mostly contributed by the predisposing factors that may be present in the patient, medical conditions. Another one is the unanticipated physiological fall, where the patient is seemingly normal, but unexpectedly there might be a stroke or a myocardial infarction, which may predispose the patient to a fall. And there's another category where there's a planned fall. The patient wants attention, and for some reason, people in the hospital or the healthcare setting are busy with their jobs, or even this can happen at home also. We might have encountered such situations. What does data say about falls? Men tend to fall more than women, maybe because they tend to be more mobile and active, and sometimes they may be in a hurry. Falls are common over the age of 65, though it may also occur in younger age groups. According to the data we have, about 60% of patients who had a fall sustained injuries, but only about 2% of them reported to the physician. Actually, 40% of them required medical care. About 35.8% were treated with first aid. Now, how do you manage a fall, and what is the role of a nurse? Assessing the risk factors.